नमामि धन्वन्तरिम् आदिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारुग्भय मृत्युनाशनं दातारमेशं विविधौषधीनां. My name is Dr. N.Anjaneya Murthy. I have about 40 years of teaching and clinical experience. I have retired from the Karnataka government service in the highest position, that is as the Joint Director Ayurvedic Medical Education. Now today we will just try to understand the greatness of Ayurveda and how Ayurveda is able to tackle the day-to-day problems of the present humanity. If we just take what are the common problems that are coming across in our daily practice, we see people coming with calcaneal spur. So typically the person having calcaneal spur will have extreme pain when he is trying to get up from the bed in the feet just below the ankle joint, and now after some time the pain comes down, and whenever the person is trying to walk, if the surface is uneven he gets pain, and when he wants to touch that area there will be pain. Normally an X-ray of the ankle joint is taken. We will find that the calcaneum bone, there is actually a spur formation, a hook-like formation. Sometimes calcaneal spur will not be there, but what you call it as bursitis, some inflammatory changes will be there. From Ayurveda, we have a very simple remedy for this type of problems. We do one procedure which is called as Ishtika Sweda. From the qualified, technically trained people, we take this brick, heat it over the gas on one side of the gas stove, and the other side of the gas stove we take sour kanji. The kanji is again prepared. You may be remembering in the ancient times people used to cook rice in earthen pots. They were not using these pressure cookers. So when you use in the cookers and when you use in the earthen pots, the supernatant fluid after cooking of the rice is called as kanji. So that kanji is allowed to be kept for some 3 days. It will become sour in nature. So this is called as amla kanji. More detailed procedures are there described in the textbook, but for practical purpose we can take this amla kanji, sour kanji. It can be done by the person in the home also with the proper advice from the doctor. So locally some oil is applied with moderate pressure over that area, then the heated brick is kept in a container, then the sour kanji is poured over that area. So the steam that is coming from the sour kanji, ankle portion and the feet portion are allowed to be fermented with this steam. Gradually, when the temperature of the brick is coming down, the person has to take his feet and press over that area. Like this, when the brick becomes cool, it is heated again on the gas. When the kanji becomes cold, it is heated again. Like this, if we do for 20 minutes per day, within 7 days, there will be very good results in this type of conditions. Along with this, we can give trigonelum ferox, that is methika churna, in the food when he is preparing chapati, puri or some other things. Normally it is called as menthya in the household language. So that menthya powder is added in the wheat flour while preparing the dough, and that from that chapati or something can be prepared. We have found that when you use this menthya, the pain and the inflammation come down and the person becomes better. Apart from all these things, some tablets like gugulu tablets, any type of gugulu which is pertinent to that particular case can be given. In pregnancy, we don't want to give gugulu. In other conditions, we can give this gugulu. Main important thing is the person should have specially designed footwear, because ultimately the footwear is it which is helping the person to prevent as a cushion between the feet and the floor. So in my experience, we have treated hundreds of cases of calcaneal spur with this type of treatment, and we have not got any bad results. Definitely we are getting good results by this type of treatments. There are no side effects, and the person becomes better day by day, and he can lead his happy life. So this is the treatment for calcaneal spur. Thank you very much.